10 most bizarre medical conditions on Earth. Number 10. Cyclopia. Cyclopia is a rare form of holoprosencephaly and is a congenital disorder characterized by the failure of the embryonic prosencephalon to properly divide the orbits of the eye into two cavities. The term cyclopia comes from the Cyclops, the one-eyed giants of Greek mythology, a mythical race of lawless giant shepherds who lived in Sicily. Typically, the nose is either missing or replaced with a non-functioning nose in the form of a proboscis. Genetic problems or toxins can cause problems in the embryonic forebrain dividing process. Number 9. Progeria. Progeria, also known as Hutchinson-Gilford syndrome, is an extremely rare, progressive genetic disorder that causes children to age rapidly, beginning in their first 2 years of life. Children with progeria generally appear normal at birth. During the first year, signs and symptoms, such as slow growth and hair loss, begin to appear. Heart problems or strokes are the eventual cause of death in most children with progeria. The average life expectancy for a child with progeria is about 13 years, but some with the disease die younger and some live 20 years or longer.
Hey guys, my mommy's gonna make a wig, and we got lipstick on, and
We're twins.
we're twins, and I'm so excited. I had a great day today, and me and my mommy are twins now, and she's beautiful. She loves me very much.
Number 8. Noma. Noma is a rapidly progressive, polymicrobial, often gangrenous infection of the mouth or genitals. Fuchsiobacterium necrophorum and Prevotella intermedia are thought to be key players in the process and interact with one or more other bacterial organisms. The mucous membranes of the mouth develop ulcers, and rapid, painless tissue degeneration ensues, which can degrade tissues of the bones in the face. The disease is associated with high morbidity and mortality and mainly affects children under the age of 12 in the poorest countries of Africa. Children in Asia and some countries of South America are also affected. Most children who get the disease are between the ages of 2 and 6 years old. The WHO estimates that 500,000 people are affected, and that 140,000 new cases are reported each year. The mortality rate is approximately 90%. The progression of the disease can be halted with the use of antibiotics and improved nutrition. However, its physical effects are permanent and may require reconstructive plastic surgery to repair. Reconstruction is usually very challenging and should be delayed until full recovery. Number 7. Hypertrichosis. Hypertrichosis is an abnormal amount of hair growth over the body. Extensive cases of hypertrichosis have informally been called werewolf syndrome. It can actually be generalized, symmetrically affecting most of the torso and limbs, or localized, affecting only a small area or location. In 2011, Supatra Sasupan, an 11-year-old girl from Thailand with hypertrichosis, was named the world's hairiest girl by the Guinness Book of World Records. Laser hair removal is an effective method of hair removal on hairs that have color. Laser cannot treat white hair. The exact cause of hypertrichosis is unknown, but it is believed to be a genetic disorder that is inherited or occurs as a result of spontaneous mutation. Medication to reduce production of hair is currently under testing. Number 6. Diprosibus. Diprosibus, also known as craniofacial duplication, is an extremely rare congenital disorder whereby parts or all of the face are duplicated on the head. Although classically considered conjoined twinning, this anomaly is not normally due to the fusion or incomplete separation of two embryos. Diprosopis often occurs in combination with other congenital disorders, particularly anencephaly, neural tube defect and cardiac malformations. Most human infants with diprosopis are stillborn. Known instances of humans with diprosopis surviving for longer than minutes to hours past birth are very rare. Only a few are recorded. In 2002 and 2003, 2 living male infants with partial diprosopis were described in the medical literature in separate case reports. Number 5. Meiosis. Meiosis is the parasitic infestation of the body of a live mammal by fly larvae, maggots, that grow inside the host while feeding on its tissue. Meiosis varies widely in the forms it takes and its effects on the victims. Such variations depend largely on the fly species and where the larvae are located. Some flies lay eggs in open wounds, other larvae may invade unbroken skin or enter the body through the nose or ears, and still others may be swallowed if the eggs are deposited on the lips or on food. How meiosis affects the human body depends on where the larvae are located. Larvae may infect dead, necrotic, prematurely dying, or living tissue in various sites: the skin, eyes, ears, stomach and intestinal tract, or in genitourinary sites. They may invade open wounds and lesions or unbroken skin. Some enter the body through the nose or ears. Larvae or eggs can reach the stomach or intestines if they are swallowed with food and cause gastric or intestinal meiosis. Oral meiosis is a rare disease caused by larvae of certain dipteran flies. It is mostly reported in developing countries and in the tropics. Herein, a case of oral meiosis in the maxillary anterior region of a 14-year-old mentally challenged boy is being reported. Number 4. Fibrous dysplasia. Fibrous dysplasia is an abnormal bone growth where normal bone is replaced with fibrous bone tissue. It causes abnormal growth or swelling of bone. It can occur in any part of the skeleton, but the bones of the skull, thigh, ribs, upper arm and pelvis are most commonly affected. Fibrous dysplasia is very rare, and there is no known cure. Fibrous dysplasia is not a form of cancer. This disorder is usually diagnosed in childhood or early adulthood and can affect one or several bones. Males and females of any race are equally affected. Treatment options may include medication to strengthen bones, medication to treat onset of pain, pain management therapy, surgery. Number 3. Hydrocephalus. Hydrocephalus is a medical condition in which there is an abnormal accumulation of cerebrospinal fluid in the ventricles of the brain. This causes increased intracranial pressure inside the skull and may cause progressive enlargement of the head if it occurs in childhood, convulsion, tunnel vision, and mental disability. Symptoms of increased intracranial pressure may include headaches, vomiting, nausea, papilledema, sleepiness or coma. In Runa's case, her skull was nearly 93 centimeters in circumference, 3 times the normal size for a child her age. At 18 months old, doctors in New Delhi diagnosed the infant with hydrocephalus. hydrocephalus treatment is surgical, generally utilizing various types of cerebral shunts because the shunt systems are too expensive for most people in developing countries. Such people often die without getting a shunt. Worse, the rate of revision in shunt systems adds to the cost of shunting many times. Doctors reduced Runa's head to 57.5 centimeters in circumference, and today, at the age of 3, Runa is now smiling and even laughing. Number 2. Harlequin ichthyosis. Harlequin ichthyosis is a severe genetic skin disease, which causes the dermis to be around 10 times thicker than normal and grow at an exceptionally fast rate. At birth, the child's whole body is encased in an armor of thick white plates of skin, separated with deep cracks. In addition, the eyes, ears, penis, and the appendages may be abnormally contracted because of resultant cracked skin in locations where normal skin would fold. It is easily pregnable by bacteria and other contaminants, which can result in serious risk of fatal infection. Constant care is required to moisturize and protect the skin. Sufferers feature severe cranial and facial deformities. The ears may be very poorly developed or absent entirely, as may the nose. The eyelids may be averted, which leaves the eyes and the area around them very susceptible to infection. It is associated with a mutation in the gene for the protein ABCA12. Number 1. Ectopia cordis. Ectopia cordis is a congenital malformation in which the heart is abnormally located either partially or totally outside of the thorax. The ectopic heart can be found along a spectrum of anatomical locations, including the neck, chest, or abdomen. In most cases, the heart protrudes outside the chest through a split sternum. The occurrence of ectopic cordis is 8 per million births. Ectopia cordis results from a failure of proper maturation of midline mesoderm and ventral body wall formation during embryonic development. The exact etiology remains unknown, but abnormalities in the lateral body wall folds are believed to be involved. Due to the rarity and rapid postpartum mortality of ectopia cordis, limited treatment options have been developed. Successful surgeries have been performed, but the mortality rate remains high.